Hey, it's Bill Russell. I'm here in my yellow hat. I wore it at Vive and Hims to signify our partnership with Alex's Lemonade Stand Foundation and the search for cures and to combat childhood cancer. I'm just blown away by the generosity of our community. With the help of our partners, SureTest, Rackspace, CTG, and some of you giving individually, we were able to raise close to $40,000 at those two events. It is just exceptional. And I would like to thank all of you who have joined us in this cause. If you would like to be a part of it as well, go ahead and hit our page, thisweekhealth.com. You can go to the top blue banner that is on our homepage and click on that to give today. Thank you again for being a part of this effort and this cause. Today in Health IT, Change Healthcare / Optum has been taken offline by an attack. More on that in a minute. My name is Bill Russell. I'm a former CIO for a 16-hospital system and creator of This Week Health, a set of channels and events dedicated to transform healthcare one connection at a time. We want to thank our show sponsors who are investing in developing the next generation of health leaders: SureTest, Artisight, Enterprise Health, Parlance, Certify Health, Notable, and ServiceNow. Check them out at thisweekhealth.com/today. All right. Yeah, just reminder, we're doing Captain's Campaign next week at Vive. If you see us around with Captain, get your picture taken. We'll give $1 for every smiling face in the picture, and we will give that to Alex's Lemonade Stand to fight childhood cancer. And we would love for you to be a part of that. And we want to thank you in advance for being a part of that. Wow, my Slack is going crazy right now. New message. So craziness. Share this. Hey, one last thing. Share this podcast with a friend or colleague. Use it as a foundation for daily or weekly discussions on the topics that are relevant to you and the industry, and hopefully start a mentoring relationship. They can subscribe wherever you listen to podcasts. All right, here we go. So here's the story. Where am I getting the story from? I'm getting it from TechCrunch. U.S. health tech giant Change Healthcare hit by cyber attack. U.S. healthcare technology giant Change Healthcare has confirmed a cyber attack on its systems. In a brief statement, the company said it was experiencing a network interruption related to a cybersecurity issue. Once we became aware of the outside threat, in the interest of protecting our partners and patients, we took immediate action to disconnect our systems to prevent further impact. Change Healthcare wrote on its status page. The disruption is expected to last at least through the day. The incident began early Tuesday morning on the East Coast. U.S. East Coast, according to the incident tracker. The specific nature of the cybersecurity incident was not disclosed. Most of the login pages for Change Healthcare were inaccessible or offline when TechCrunch checked at the time of the writing. All right, so it's offline. Let's see, Michigan local newspaper, the Huron Daily Tribune, is reporting that the local pharmacies are experiencing outages due to Change Healthcare cyber attacks. Let's see, Sharer Health, a healthcare provider in Michigan, said on its Facebook page that it cannot currently process prescriptions, though through patients' insurance, citing that the nationwide outage from the largest prescription processor in North America, referring to Change Healthcare. Change Healthcare is one of the largest healthcare technology companies in the United States. Change Healthcare handles patient payments across the U.S. healthcare system. The tech giant boasts on its website that it handles 15 billion healthcare transactions annually. And if you break that down by a day, there's a lot of transactions not happening right now. And that 1 in 3 U.S. patient records are touched by our clinical connectivity solutions. In 2022, health insurance giant United Health Group completed its merger of U.S. healthcare service giant Optum and Change Healthcare in a $7.8 billion deal, which allowed Optum broad access to patient records on tens of millions of Americans. Optum provides technology and data to insurance companies and healthcare services. Both Optum and Change Healthcare are owned by health insurance giant United Health Group. This is a big one. This is not the first one for United Health Group, by the way. United Health Group was hit a little while back. Actually, it's a couple of years back now, so it's been a little while. But this is serious, and the question becomes, what's next? What happens next? And for these kinds of things, I generally go to my friend Drex DeFord, who has been following this pretty closely and giving me updates and whatnot. One of the things he just posted out on LinkedIn, the next problem we're going to face is your pharmacy leaders, maybe others, will pressure you to reconnect before you feel like you have proper all clear notifications and documentation. If you're not talking about rules of engagement for reconnection, right now is probably a good time to get ahead of this. And it's going to be an interesting amount of political pressure to reconnect when you don't have these transactions going. It's going to create problems within your system. We had one of the better webinars that we've ever done on this show was with Lee Milligan and Sky Lakes Medical Center, and we talked about this idea of rules of engagement. And it was interesting to hear, first of all, Sky Lakes Medical Center was a Community Connect site, Epic Community Connect site, to Asante Health System, which is where Lee Milligan was the CIO. And Lee got a call late or early in the morning that Sky Lakes had been ransomed, and they wanted to know, what he wanted to do. And he, as a physician, understood that when he said, hey, we need to disconnect them, he understood what he was saying. He was essentially saying, hey, we're taking that hospital offline. But what he was looking at was the greater good. And he was trying to balance if they can take them down, can they come across the wire and get to us and take our system down, in which case both health systems would be down. And so he made that call, and that was a very difficult call to make. But again, understanding the rules of engagement, understanding the priorities going into those things is really important. But more interesting to me was the conversation later of what they had to do in order to reconnect and bring them up. And those were the harder conversations, because there was pressure all along the way to do it. And I don't think they did it for at least a week. It took them to get their house in order enough to reconnect to Asante and the primary Epic instance that was driving the Community Connect platform. And so that was a big deal. And there was a lot of political pressure that comes your way when that's happening. These are the kinds of conversations that Drex is talking about you need to have before you have an incident, and just determine, what are we going to do? Third-party risk is the biggest and hardest thing for CISOs and CIOs to get their arms around. And part of it is because we rely on these third parties so much. And people from time to time will ask me, how important are these third parties? You get an idea here. If the pharmacy cannot dispense the prescriptions that are coming in because of an outage, it's a pretty serious third party risk. So it's not only revenue cycle and those kinds of things. There's a lot of organizations that we've tapped into that are performing services for us. And so this is an interesting problem. We're going to keep an eye on this one, and this is probably impacting a lot of people. I remember when the Kronos outage happened and a fair number of health systems were impacted. Part of my recommendation is to find out who else has been impacted. Find out who you can get on the phone with. I really believe in the power of interacting with your peers, especially peers that are going through a similar problem set, so that you can share what's going on at your health system, how you're thinking about the problem, maybe have someone to bounce things off of and have discussions. You can always do that with Drex and I. If you are in this situation, you can reach out to us, and we would love to be a sounding board for you on those things. But again, I think your peers who are going through it as well is a great source for that. Again, we will be following this one closely. This is a pretty big deal given the number of transactions that Change Healthcare does for the industry. That's all for today. Don't forget, share this podcast with a friend or colleague. We want to thank our channel sponsors who are investing in our mission to develop the next generation of health leaders. SureTest, Artisite, Enterprise Health, Parlance, Certify Health, Notable, and ServiceNow. Check them out at thisweekhealth.com/today. Thanks for listening. That's all for now.